Hello, everyone, and welcome to Metamorphosis Podcast. Today's session is about ST3 general surgery. We have our guest, Dr. Nur E Jannat Jenny, with us today, who has successfully secured national training number ST3 in general surgery. So, congratulations, Jenny. How are you?
Thank you so much. I'm good. How are you?
I'm fine, thank you. Wonderful. Today, I will try to make the session very precise and as effective as possible. But before proceeding to the questions and so many informations, I'd like to give a big gratitude and thanks to Dr. Atikur Rahman for organizing these beautiful sessions after sessions, which eventually will help, I believe, will help the participants or the aspirant surgeons who are planning to get into the training or trying to get a training number in the UK. Um, Organizing these things, liaising this relations between the people and arranging. It's not a good or easy task, I would say. So yeah, thank you, Mr. Atikur Rahman, for organizing these beautiful sessions. Going back to Jine, to begin with, I will not ask you direct question to start to warm up. What made you choose general surgery? We know we have different subspecialty in surgeries, urology, someone tries neurosurgery. So what made you choose general surgery as career?
Basically, like from the very beginning, I wanted to pursue colorectal surgery. Um, I think in my high when I'll be a higher specialty training, I will pursue colorectal. But before that, I have to complete general surgical training. So that's the reason I choose general surgery. And yeah,
Any experience beforehand to the colorectal? Because general surgery, we know we have subdivisions of hepatobiliary, colorectal, and the upper GI. So you started in this country to aspire as a colorectal, or you have some other story behind choosing colorectal?
yeah, definitely. So I did my FCPS Part 1 when I was in Bangladesh, and I started my surgical career and finished my training, FCPS training 3 years. And
Hmm.
uh,
Okay.
and then I did my MRCS and moved to UK. And so rather than kind of working here as an in an SHO post and
Mm-hmm.
upgrading kind of a register post, I decided to kind of build my portfolio first
Mm-hmm.
and work in various departments. I was lucky to get kind of a Newcastle surgical rotations program. So I'm based in Newcastle at the moment. I was in a surgical rotation program that gave me upper GI, colorectal, pediatric surgery.
Mm-hmm.
And also I was a teaching fellow in transplant surgery as well.
Right.
So
Okay.
I have explored various surgical specialties in UK and decided that I will definitely go for colorectal.
All right, as long as you have decided, made a plan, and secured it, congratulations again. So, okay, we will go get into the questions and the information that we need to chase our dream in a training number or get a training number in general surgery. So, I'd like to start with. So, I am going to ask you in two session questions. Like one is the questions on self-assessment thing that we need numbers to get into the interview, and then I will ask some of the questions or information regarding the interview session, what to improve, what to focus on. To begin with the numbers that we need to get into the interview call, we all know that to enter into the training, we need to apply first, obviously, and then we need good numbers to get the interview. There are certain questions or criteria against which we get the numbers. We all which changes in every few years, I believe.
Oh,
I will, because you have secured this year, I will be asking questions on the basis of this year criteria. Hopefully, it doesn't change this upcoming year, so I can work on it. So there are, as I said, this year I think there was a seven category for the self-assessment scoring. If I'm not wrong, correct me if I am wrong. Some of these we cannot work much on. It builds up with the time. For example, the very first criteria, I think, how long you have worked in general surgery. You cannot like lie it, or you cannot manipulate it or work on it. It just develops with the time. 1
Mm.
year, 2 year, 3 year. So
Yeah.
I'm not going to ask you about that. There
Yeah.
is nothing you can do.
But
The second,
wondering, like, in the first question, how long
mm,
you have worked post foundation, you have got general surgical experience. So
mhm,
I've got like 3 years experience in Bangladesh before.
mhm,
Uh,
mm,
but we have done like foundation year, kind of just 1 year. Uh,
mm,
so our post foundation, like post internship experience, count as kind of FY2, and you can
mhm.
show them like FY3 as well.
Right.
Um, and kind of the operative exposure we get in FCPS training, during the FCPS training, I think they are not counted as well. So you can say that kind of uh, that my operation was under not kind of supervised, or you were kind of FY3, you haven't done enough operative
General
exposure,
surgery. Right. Okay.
general surgery exposure, and you can show them like as an FY
That
3.
that's good to know,
Yes.
because sometimes we confuse, because oh no, because after certain years your mark decreases rather to increase. It's not like that you can get good marks with the increases. So we can count this as F3 or F4, rather saying that I'm specifically working in general surgery. That's, well, good to know. Anything else you want to add?
Uh, so regarding the years, because when you kind of, for the Bangladeshi students, obviously, when you kind of had the GMC registration, you have to kind give every details of your previous experiences and where did you have worked before. Um, you cannot lie, obviously, about your, but you can
Yeah.
obviously show them that it was FY2 or FY3 equivalent. And if you get signed it from your previous supervisors in Bangladesh, that should be more valid in that case. So they will,
Mm.
in my case, they have accepted.
Right. Okay. So it's a good point to take the notes that if we are thinking of we are exceeding the time for the
Exactly.
exposure to general surgery, we can count it as F3, F4.
And
That's a good
moreover,
information.
the core surgical training here, I mean, before
Mm.
entering the higher surgical training, they do core surgical training.
Yeah,
Um,
yeah.
I have kind of completed core surgical equivalent training after coming year was in Newcastle Surgical Rotation Program. Uh,
Hmm.
so you can show them that part of your training was core surgical training equivalent. Uh,
Hmm.
so they will accept that as well if you show them kind of enough evidence that you have part of your experience was FY2, FY3 or core surgical training, so they will count them.
All right. Okay. And regarding other thing, like the second criteria, or at some point it says you get some mark for working in different surgical, like I think ENT or orthopedics. Uh, if someone has the exposure back in country, for example, they have worked 6 months or a year in urology, do they count that experience in this country?
Yes,
Or
count
okay.
because they counted my one. I did 6 months of urology. So they counted my one. I did pediatric surgical training in here. So
Mm-hmm.
obviously it was in UK. They will count that, but the Bangladesh one has been counted as well. So
Okay.
they will count.
Right. And the other thing, you obviously did your CREHES form signed before applying, or they count, as you said, you showed a CT equivalent to your surgical rotation. Which one counted?
Um, I did kind of CREHES, I did sign my CREHES form, but
Mm-hmm.
I had got my ARCP, that was a core surgical training equivalent. So I
Mm-hmm.
could apply with that ARCP, but I didn't took risk because this year they have done so many changes and
Mm-hmm.
shortlisting was very competitive. So I did do the CREHES form sign and applied with the CREHES form rather than the
Going
ARCP.
for the CT. Okay. Right. So I will ask you the questions that where we can work on to
Mhm,
improve our marks regarding the audits.
mhm.
I know it's not anymore about the quantity, not the numbers, how many have you done, rather quality. Would you mind giving us the idea? What's your understanding in terms of a good quality of projects, like a good quality of audits? Which topics, or give us some examples of these are the things in your eyes that these are the good quality audits.
So like when I first came into UK, I was more um, doing like quality improvement project, which is kind of single cycle.
Yes,
Uh,
yes.
so before this year or even the last year, they changed the criteria last year. You
Yeah,
have
you have
to,
to
yes,
complete two
uh,
loop cycle. Yeah.
do best audit. Before that, I was focusing on quantity. Uh,
Mm,
that was my mistake because I am doing single cycle and it takes less time rather than completed second, I mean, both loops, it takes time. Uh, but when they change the criteria, and there is kind of, I had got uh, three or four, two best cycle, close cycles, but I did submit two of my best audit. By saying best audit, I mean that it has to be general surgical.
yeah.
It has to be kind of, you have to complete the cycle, and you
Mm-hmm.
have to be kind of present in as oral presentation, better kind of if you do in a renowned kind of organization like ACPGBI or ACID or any international conference or national conference. So the mark they give, each of the audit is kind of marked by two separate consultants. So they will assess your audit or QIP separately by two consultants, and then they will give whether the audit was poster, whether the audit was oral, and
Mm,
based on that, whether you have presented in national or in a local or regional meeting, they will count that as
yeah.
well. So
So
overall,
that defines the
yes,
quality of your audit, where
yes,
you presented it.
exactly,
Okay.
and most importantly, how it has impacted or affected your trust, and how big the change was by through your audit. Like, have you, I mean, is it kind of few patients were kind of affected, or has it caused a mass effect, or I mean, how big was the impact of that audit? So that defines how good was your project, and you get the kind of best point for that.
Right. And what would be the best point to achieve? Like full marks.
Exactly.
Okay. Right. The other question regarding when I'm in the audit, because as I said, you have to present it no matter what. Yeah, to pass a audit or to make it complete, you have to present it no matter what, or even if it's in the departmental session or meeting, if you want to improve there. My question was, if I put it as a presentation, suppose I have done audits, which I will present in some kind of conference or the regional meeting. And if I put it on my presentation section,
Mhm.
does that get the equal marks, or because I have presented or I have submitted same topic in two sections, will it decrease my mark?
No, it doesn't matter. It
Right.
doesn't matter because these are two separate sections. You get point for in audit section, and you get separate points in presentation section. So it
Even
doesn't
if the
matter as
topic
long
is same.
as, yes, even the topic is same, as long as kind of it has been presented to national and regional or international conference, you will get mark.
Right. Okay. And the third one can be your quality improvement project. It has not, doesn't need to be closed loop or two-cycle audit, if I'm not wrong. Right. Okay. So I hope I made it enough clear and informative in terms of audits. Let's go to my second, no, not second, next question. It's regarding the presentation. I think I have touched one question, that is, even if it's the same presentation that is based on your audit that you have presented earlier, it won't lose or make you lose marks. In terms of presenting the paper, like if I do the publication, which is also the same separate session, it will also go same like audit. You don't lose your mark if
No.
you say that I have presented my publications. Right. And does the national or international, where you have presented, it creates difference in your marks?
Yes, definitely.
Right.
If it's international, you get more points than national and regional, and obviously the national next to national and the next regional conferences. But local doesn't get any point.
No,
It
I
has to
no.
be regional,
At
national,
least
or international.
international. And you get more marks if it's oral, is
Yes.
it?
Oral.
Yes.
Again,
Okay.
if you kind of present national oral
Mhm.
versus international poster, I believe the international poster will get more marks. So it depends the
Right.
quality of the presentation. Where did you get presented? So it will get more marks.
Good. It's good to know that. So it's more like international goes up, even if it's or national oral presentation, or but it will get more mark even if
Yes.
it's the
Yeah, or
international.
it can be similar, kind of, it can be similar, like you get similar points for both of them. But
Right. Yeah. All right. And now the most vital part where I think the INGs or the people who are not based on UK graduation, they struggle the publication. Um, choosing it's very difficult to me. I find very difficult when it comes to the working on the papers. So any suggestion regarding choosing a good topic to do your papers or publications? Like, is there any way to think of, because it's, I think the most hard part is to choose what you are going to work on, what you are going to like do your paper. So any suggestions that these things you can look for, or these are you can search in internet, or like, is there any way we can get a good topic for the
and it will
publication?
give time before your application, isn't it? So
Mm.
kind of choose simple topics. No point of doing a project or research project that lingers kind of 2 years or 3 years, because if
Mm.
you go to the consultant, most of the consultant will give you some kind of project that's 250 datas. You have to collect a lot of datas, and it has to be kind of analyzed. A statistician, you have to contact with them, and then the publication takes a lot of time. The consultant will
Mhm.
want you to be present in high impact journals, most of the UK consultant. But
Yes.
honestly, for kind of, you just need to get points for that. So
And it's like within 8 or 9 months time. It's
yes,
not like you
uh,
can waste years in the
yes.
publications.
So what I did is kind of I focus in audit. I mean, publishing my audit projects, and
Mm.
I spoke to my supervisor, like I have got no publication when I was in Bangladesh, so I need points for that because it's very competitive, and I focus on having, I mean, narrative review, writing a narrative review along with a focused group, so that gave me marks for that. I mean, just tick the mark for the publication. Narrative review doesn't take time. It takes like 4 to 5 months to publish a paper, and you can write it easily without a consultant involvement, and you can easily publish in kind of even it's kind of, you get more marks if the publication is in high impact journal,
Yeah,
uh,
that
but
makes sense. Yeah.
if kind of curious, or it kind of, you can publish in the Bangladesh Managing Medical Journal, so that will come. One of my publication was a co-author publication in Managing Medical, and one of them was kind of in curious. So I got two publications, actually three publication, but I gave it kind the surgical oriented topics, and that gave me marks. So focus on kind of simple topics. You can do narrative reviews rather than involving in high kind of volume of data
Mhm.
publication. You just need kind of tick
Right.
point.
Any journals apart from Curious, that publishes their papers, or in
Covered in
short?
this one. Yes, sometime the Managing Medical Journal, you
You
can
can do it from here. You can
um,
request to publish it
yes,
from here.
yeah, definitely you can publish it from here, but you have to chase them a lot.
Ah, right. Okay. And in terms of what I was about to ask, so you can publish also your audit if
Yeah,
it's
definitely.
published, you get mark. It
Yes.
has
If
not.
the audit is kind of a good topic, and I
Mm.
think the patient kind of population, total
আপুকে
population,
অনেক সুন্দর লাগে
big, total population is big enough to publish, then
Mm.
obviously you can publish it as well. And the topic is innovative and haven't published before, it's definitely publishable, so you can go for it.
Right. Okay. That's a good thing to know. Right. So here, and I think other topic is if you have done the masters or if you've done the PG cert, which also we can't do much because here, if you want to do masters, it takes 2 years, I think, if you want to do it
Uh,
part-time, and it costs you money.
Masters is kind of 1 year, but it
Mhm.
costs a lot. You can do a PG cert if you have got time and energy. I did a PG cert when I was a teaching fellow in transplant surgery, in medical education of 1 year from University of Central Lancashire, and it gave me
Mm.
1 marks. 1 marks, actually 1 marks or 2 marks.
1 month, PG cert,
Yeah,
1 month. Yeah.
it took all my energy. I mean, I was in clinical and teaching fellow.
Yeah.
It took all my energy basically, and it was so hard, but completed it, got your point. But if you have time and energy, just do it because you need
My other question will be regarding this PG cert. I think the Royal College England, the RCS, they have the PG cert
surgery.
also.
Yeah,
Yeah, which can be done. Of course, you need money to do that. Will that count? Do you know the PG
yeah.
cert?
As long as it says it's PG cert, it will count.
Right. Okay. So I would say
But
the
I would
listen.
say one thing, like doing a PG cert in medical education,
Mm, mm,
it helped me to build up my writing, academic writing.
okay.
So I could, so when I was writing a narrative review for publication, and I found that it helped me a lot.
Right. Okay, it's good to know. But regarding the cost, I'm not going to talk it about it here. I just want to warn that PG cert, if you want to do in medical education under certain university, you can do it in 6 months time least. But yeah, it will cost a good thousand uh, pounds.
But
It's just your money.
if you manage to find a kind of teaching fellow job, it is funded
Mm-hmm.
by the trust. In my case, the trust
Oh, right.
did all the,
Okay.
so
All
four
right.
thousand pound, it was funded by trust.
It's good to know. I mean, it worked for you anyway. That's good for you. But yeah, we can. I mean, masters. It's bit of kind of things, but you can do the PG cert. I would absolutely recommend it also. And if as Jenny mentioned that it really difficult to do work and do PG cert at the same time. So because I've seen people doing the RCS one. I think you can do that bit with less effort. You can just quickly go through, read, and do the some CBD case based study, submit it. I think that's a bit easier than the under doing PG cert under university. If they both give you the same mark, I would say go for the PG cert. It doesn't cause you any harm. Right. Other question I want to ask, because I think in the criteria there is nothing related to teaching in general surgery, but I'm going to ask you about this. Is there any role of teaching in self-assessment in general surgery?
No rule in self-assessment, but you get point in your interview. Once
Right.
you get shortlisted for the interview, in the portfolio section, there's a good marks for the teaching, and they'll
Mm-hmm.
ask you kind of what's your teaching experience, the formal and informal teaching, and
Mm-hmm.
what you have done. Uh, so I have done a PG cert, so I have told them that I have done a PG cert, and I was an anatomy demonstrator for 8 months in Newcastle University, and also I have been a teaching fellow in transplant. So I told them they were very impressed about that. Uh,
Right.
yeah,
Okay. And because you said you were a anatomy demonstrator in here, what kind of evidence you have to give in the interview that because anyone can say that I was teaching or I take part in teaching. Every university hospital here, they arrange weekly teaching where the registrars or SHO can take part. So is there any proof that needs to be given in the interview or in the
Uh,
this?
so th- uh, during the interview, the examiner cannot see your portfolio, but you have to be honest with them. Uh,
Mm-hmm.
so you cannot lie. So they know about the structure and the system here and how much an SHO or registrar can do in NHS setting. So you cannot lie with them.
Right.
But you have the liberty to kind of sell yourself. So I was a teaching fellow, and I have got the evidence. I was in kind of 1 year teaching experience as a teaching fellow in transplant, and 8 months during the Newcastle surgical rotation program in Newcastle University. I got evidence from there as well. So yeah, and uh, even
Right.
if you have done it, but you haven't sold yourself enough, kind of you didn't mention about how you interact your kind of students, and what how it has made you a good doctor, and how it's gonna help you to be a good registrar. So in
Mm.
interview, all that matter is how these things has impacted to be a good registrar, not just you have done these things, not just that. So you
Mm-hmm.
have to say them how it has kind of impacted your career, or good you are a good doctor, or you are the best doctor, so that they can hire you.
Right. Okay. In terms of, again, I'm still continuing the teaching. What needs to be added in the portfolio? Because as I say, everyone gets involved in teaching from time to time. What evidence in the portfolio that we should submit if we say that we are taking part in teaching? We do teaching informal and informal. That cannot be collected as evidence. But if we participate in formal teaching, suppose you are taking part in weekly teaching to teach the
Mhm.
F1s or the SHOs, or your department has weekly teaching where we, because I'm just asking, I would be very specific. For example, in my previous trust, I worked with the upper GI team. There, every week we had a teaching session where the consultants, the registrars, and the F1s for the upper GI will be present. And there we used to appraise paper or journal that we would say how good the paper is or how bad the paper is, or what's the shortcoming of the paper. We see the result, we present it. So in that sense, what type of evidence we need to put in our portfolio?
So you can collect the evidence, I mean, feedback from the students, like F1s or SHO you have taught, a
Mhm.
better kind of a particular topics that you have taught, kind of suppose like bowel ischemia, or you have taught like
Mhm.
image surgeries, or any of the topics, suturing or appendicitis, any topic you can choose, and taught them and collect that evidences and get it signed from your supervisor and get into the kind of HORAS portfolio or ISCP portfolio. That will help, and you can show them that I have got it's signed from my supervisor. And as a surgical trainee or surgical, even you are as a SHO, if you keep a log in your ICP or HORAS portfolio from the very beginning, just show them the ICP things. And yeah,
Okay, all right. I think I've got my answer. So whatever portfolio you are maintaining, just you need to put that what you have taught,
yes.
or
As
what you
long as
can also
your
put the
supervisor is
slides
happy to sign
and
that you
get
have
it
taught
sent to
this topic and get it signed from your educational clinical supervisor, they will count it. And you have the
the.
feedback from the students, so
And
there's no
you
problem.
can say it, you can say it in the interview,
Yeah,
whether
exactly.
they go for the review in or proof in the portfolio. That's a different thing, isn't it?
Yes,
They
yeah,
can have it.
yeah.
Right. But in the interview, you can say, you add it in your portfolio, and then
Mhm.
you can say it. Right. Well, I think for self-assessment, I've touched all the seven criteria. If I'm not wrong, remind me if I've missed some.
I think
Any?
so.
I think I've touched everything.
Application, presentation, audits, yeah, I
The
think, and
PG things, PGSR things, then yeah.
just number of appendicectomies. I
Ah,
think
yes, the other thing. Wow.
yes,
Well,
the
it's
most
you
important
who have
one.
to change it. Yeah. I think yeah, everyone knows that bit, and there is nothing you can advise. It's just you who has to chase it.
Yeah, exactly.
Right. Yeah, appendicectomy one. So I know it's difficult to say how many marks you need to gain to get the interview, but anything in everything there is a cut mark. What would be your suggestion that try to achieve this mark to get that if you get this mark in self-assessment, you will be able to get an interview or be hopeful about the interview? Do you know what would be the cut mark
I think
for?
it's getting difficult every year passing.
Yeah.
So last it was kind of 60 cut mark. This year I think it's a bit high, like 63 or more than 63. Uh,
Mm.
so I would suggest to be kind of 65 would be enough to say that you will get shortlisted, and then you can start preparing for your interview once you have kind of 65 around and you are in kind of peace in your mind.
Yeah, and that 65 marks, like you predict by when you do see the assessment and submitting the evidence, or when after they give you the marks?
Uh, After they give me my marks, you
Because
believe it's
what
both
we
ways?
expect, sometimes we get less or sometimes we get more the marks. It's not like as we think that, I've submitted my two audits, I will get full mark. It doesn't work
Because
like.
it's not a straightforward things. From last year,
Mhm.
they released kind of marks self-assessment, and they just give you, okay, you have claimed certain amount of mark and you have got these things, maybe few less or more, but
Mm.
from last year, what happens, like each of your audit or each of your publication, whatever you're submitting, they are assessed by two separate consultant, and their marks varies. So you really cannot say how much marks you are gonna
Yes.
have your shortlisting score. So it's really
Right.
difficult.
And do they subdivide the mark? I believe they subdivide the mark in one criteria. For example, audit, they give you mark on the base of certain questions like the
Yeah,
quality of course where it got presented, as you've mentioned, and
exactly.
this varies. Because I think the audit is the most suitable place where you can get a
More
good amount
marks.
of marks, isn't it?
Yes.
Each can get 8, 8, and I mean how I don't know exact how many marks you get, how much mark you get in audit.
Um,
Higher, twice
so each of the audit is kind of assessed. The highest mark you can get is like 8.
for each.
As per I remember. So they will mark you for a study of the audit you have done, and the how much you were involved in the audit project, and
Mm,
where you have been presented, whether it was presented kind of in local or kind of, if you say that I have presented in locally in departmental meeting as well as in the kind of poster presentation in national or regional meeting as well in a renowned organization, then
mm,
I think these points carry more marks.
right.
And also kind of execution of the intervention, or so have you done it properly, how much involved you were in the intervention part, or is it just was done by your consultant, not by you, and
Mm,
have follow up or not. So this kind of thing carry more marks.
right. Okay. So that's it for the self-assessment. I will jump to the interview section now. So in interview, like we know you've said after getting the assessment and when you number when you were were hopeful that you might get into the interview. Uh, how should according to you, how should you prepare? Like, is there anything you should focus on? Is there any known group study, or you can do some practice? Like, how does that work?
So I would say, like, as an international medical graduate, so
Mm-hmm.
once you know the NHS very well and
Mm-hmm.
applied and shortlisted for the interview, prepare start preparing very early. Do not wait for the interview time or 1 month, say 2 months. So prepare very early, since that before the application has started. So if the application normally start in November, so I would say, like, start 6 months early. And it takes time to reach into the peak in your interview fluency and practicing. Kind of fight for me, it took a long time, honestly. Like, I started last year, I started very early. Last year I was ranked but not offered a post. This year,
Right.
because I was a bit prepared, so I started a bit late. But I suggest for everyone, kind of start preparing early, because we know the answers. It just how you
How
do
you
in
say
the
it,
interview,
isn't
and
it?
how you
Yeah.
sell yourself in the interview, so that they're convinced that you are the best register they're going to hire.
Right. And when you say prepare early,
Mhm.
what do you mean by that? Like, I know I have to prepare now. Like, what should I prepare for? What should I focus on? We all know it's not about just the fluency,
Yeah,
and we know that you have to be sensible when you
exactly.
say something in front of your interviewer, the nicest way possible. You have to be slick. You have to be very sensible. Just not. It's not about saying quickly or saying the right answer. It's the
Yeah.
way you say it. So that's why I'm saying, is there any tips or anything we should follow? Any group or any specific resources we can look through or go
Uh,
through?
exactly. There's a lot of resources now. There's got Medibuddy training portal you can use. There's MedSet, and there's kind of one of the courses is Egyptian Society. So it depends, like, how much you want to spend on these courses, and how much you want to kind of you can share with your buddies with whom you are
Mhm.
practicing. So for me, I have honestly uh, got all the subscription, and I have
Mhm.
practiced with lot of people before my
Mhm.
interview with a British co-trainees. So, I mean, how their answers is structured. I mean, how is their answer pattern, how it is different from my one, whether
Mm,
I'm doing anything wrong, so that they can correct you kind of, and you can also correct them as well, giving feedback to each other. And not only the British, like and just find with a kind of a regular practice partner, so that
mm,
uh, yeah,
right.
and it helps. So find a regular practice partner from very early, and then when you are reaching your interview time, kind of a month ago, start practicing with multiple people with different accents and different kind of, especially if you are kind of working as an SHO, um,
Mm,
practicing with a register will help. And if even kind of, if you're working as a reg, practice with others multiple times.
otherwise,
Yeah.
yeah.
Uh,
Now, give us an idea of the real picture of interview because um, we haven't had the interview. We don't know how it works. So if you just say that this is the way it starts, they ask you this question after this question. The way as I've discussed the criteria, because I have the access to see the criterias, but in the interview I have no access what they ask, how it is subdivided. If you give us some insight that this is the way the interview takes place, would be highly appreciable.
So the interview is on kind of three station: clinical, management, and portfolio. So each of these stations is 10-minute duration, but you get extra 5 minutes for the clinical and management before that 10-minute slot to read the
Mm,
question and prepare your answer in your mind. And the question is very big and sometimes can be tricky as well. So you have to formulate that structure, and you have to reach to the diagnosis, and you have to kind of prepare for the I would say tail extra questions. So in 10 minutes they will judge you, and they will kind of assess your knowledge, whether you are confident, whether you are knowledgeable to be a register, whether they are happy to accept you as a registrar. And you have to show them, and you have to answer well, structure your answer, and
mm,
be methodical in your answer, not just random. You know everything, you just have to, uh, I mean, structure. There is lots of structure you can follow. I follow this SPY structure that, and also uh,
right.
uh, it helped me kind of in 10 minutes time, in 5 minutes time to structure is very difficult, but you have to,
Mm.
the more you practice, it will come along.
Right. Okay. And you said it's three sections. So
Yeah.
they say, can you subdivide, name the subdivision of these three sections? I know,
So
I think one is the portfolio station.
okay.
Is
So
it?
one is clinical, one is management, one is portfolio. So in portfolio section, so I have, like, I will not get into kind of clinical. You get a lot, kind of, you get any scenarios, and a very difficult scenarios, or it can be an easy one.
Mm,
But it it's tricky. Basically, they will not give you a straightforward question. I mean, they will give a tricky one and complicated one you see in kind of daily life, and kind of chaotic situation, how will you deal with. The management scenarios are kind of very multiple situation. You have to manage them, how well you manage when you'll be a registrar. So they want to see that kind of capabilities in you through the management scenario. So in my case, there was a scenario. I'm working in a busy kind of district general hospital, doing a night shift on call, and fighting. There was a My case was a very unwell patient. There was
mm,
another unwell patient in other department, and there was anesthetist was not happy to give anesthesia, blah blah blah. So there was a multiple situation, so you have to structure your answer according to the priority of that your situation, and how you're gonna deal with the other colleague, how you're gonna manage your consultant, how you're gonna divide your F1s and SHOs to tackle the situation. So basically what the
that's
boss
the management
will
station. That's
manage
the
the
management part.
situation. Yeah,
Okay.
yeah. And
And
clinical, like, you have to uh, reach to the diagnosis and what's the management, and few kind of tail of the questions to assess your knowledge. Uh,
it's kind of knowledge based, you say. The clinical is knowledge part. Management is how you manage the situation.
yeah,
Yes.
exactly.
Okay. When you are in the dead end. Okay. All right. And the third one is?
the portfolio section. So they
Okay.
will ask you kind of 3 or 4 questions. uh,
Okay.
they can ask you anything, but basically the one which have not been assessed in the self-assessment, they will ask you here. So one is teaching. They will ask you like, tell
Right.
me about
Okay.
your teaching experiences, what you have done so far regarding your teaching, and how it has impacted to be a good surgeon, and what you get, I mean, what you have done so far, kind of as a teacher for your medical students, or uh,
Mm.
this kind of question will be asked. And do you have any kind of formal experience? Like I told them that I've got a PG cert, and how, even though you tell PG cert, how it has helped to be a good surgeon. So I told them that it has improved my academic writing, and I helped my foundation, one of my foundation training, to write a narrative review. Even I have written a narrative review myself after doing a PG cert, and I
Mm.
think it is one of the finest quality to be a good surgeon and good researcher as well. So
Right.
it does, yeah. So, and then the second question they ask is kind of um, what else? So one is teaching, and then you will ask you, tell me about your operative experiences, what operation you can do, or they can ask you like, go through your CV, what have you
Mm.
done
Okay.
since your graduation, and uh, and tell me about kind of how many lap appendix you have done, and what you have done basically after you have submitted your application. That's a common question. Uh,
Okay.
since you submitted your application, like it's finished at January, so I have done kind of publication just before my submission of application, but after the uh, circular has been kind of they have circulated the um, SG3 interview, but they haven't. So I told them that I have done it. I was honest. I have done it. It was after the circular, but it wasn't before. It was before the application. So
Mm.
they took my answer. So I believe so.
Yeah.
But as long as it was after the SG3 interview, circular, I think they will count it. Just tell them, be honest in your interview. So they will ask you, this is
So
the
after the interview call, or when you submitted the application, like the self-assessment evidence, since in between, which one? Sorry, I didn't get it.
sorry.
Um,
So after, they will ask you after what you have done after your application. So
okay.
even you have to structure them according to camp, what you
Mm-hmm.
have done clinically, what you have done academically, and what you have done as kind of leadership and management, and what you have done personally. So, uh, so you have to structure your answer. But the most important thing they want to hear in this question, what you have done academically. Yeah.
Right.
And
Okay.
I have done one publication after my application and one before my application, but it was after the circular of the ST3, like after
Mm.
November, but before January. But I have told them that I have got 2 publications, but one was after this application and one of the after the circular. So I think they have accepted my answer, and I think they were happy that I was honest.
Mm-hmm. Right. Okay. As I mean, it doesn't matter. You have reached to that point. So you've got your training number. It matters is that you've succeeded what you have started. So again, congratulations. I think I came to the end of my questions and query, and I hope it helps the people who will listen in the future or who has already joined in this session. And also, I hope I can use it to improve my things, experience, self-assessment score, so that I can be at some point get the training number. Hopefully. Thank you so much for putting this insight into us. Anything from your side that you want to mention that might help us in getting the training number?
I think focus on simple things rather than things that takes longer to build your portfolio. And you have to collect all the evidences before November, and you have to get everything signed from your educational supervisor before
Mm,
November. And
right.
at the simultaneously you have to start preparing early for the interview,
Right.
and that's what we lack from the British candidates. They're
Okay.
fluent, then I mean the answers comes very spontaneously from them.
Yeah.
But for us it has to be well practiced, and maybe for me, like, it worked that way. I have to practice a lot. I know the answer, I have to structure it, and I have to kind of think in my own language in Bangla, and then have to formulate it in English, so it takes time.
It
So I
takes
have
time.
to practice a lot.
Yeah, I think, I mean, fair enough. It's not just your problem. It's, I think, 90%
Exactly.
of us face the same thing.
And get your
Right.
senior,
Okay.
there are, I mean, there are kind of seniors from Bangladesh who got into the training. So get help, ask everything, what possible way you can be helped by them, and help yourself and help others as well. I think,
No,
I
true.
think that all matters.
Right. Okay.
Nusrat Jenny, sorry to interrupt. There's a question on the chat.
Mhm.
Okay. Oh, okay. Sorry, I didn't realize. Okay. I've got a question that is how to show in evidence that the training done in Bangladesh was F2, F3 level.
So normally, the UK foundation year is 2 year, while we do 1 year internship in our country. So in my case, I have done casualty, I have done general surgery. So I have put
Mm-hmm.
kind of, I got it signed from my clinical supervisor or one of the known consultant from Bangladesh that I have done this training here, and it was my post foundation. So they will count the first year after you do the FY1 or internship. The first 1 year they will count as anyway as an F2 if you get it signed from your consultant, and that's fine.
Okay. So you get a letter kind of stating that you have worked this duration, you were with us, and get it signed by a consultant or a professor in your
Yeah,
country,
exactly.
and show the evidence to the medical educator or your supervisor in this country to get it countersigned. I think that's the way you
Yeah,
put the
yeah,
evidence,
yeah,
isn't it?
definitely. Yeah.
Yeah.
It doesn't have to
Okay.
be countersigned from UK consultant, but normally they will count the first 1 year as an F2 because you haven't done any F2, isn't it? In my case, I have done surgical training in Bangladesh, and part of they will count it. I mean, they don't know what's the structure of the surgical training in Bangladesh, whether they do core surgical training, they have higher surgical training, they have got F2, which we don't do in Bangladesh. So you can
Yeah. Okay.
do surgical training that it was F2, if F2 equivalent or F3 equivalent, or you haven't got much exposure, or you just did 1 year internship, and the post 1 year they will count it kind of second year of foundation training.
Right. Another question was submitted that can I use my logbook from Bangladesh to show the number of the cases or local presentation that I have done there? I believe you can.
Yes, you can show them, but it depends on consultant whether they will accept or not accept um, the logbook.
I'd say take a chance, take the chance. Whether accepting or not, it depends on the country.
Uh,
Yeah, all you have to do is to
it's logged
submit.
in the e-logbook because most of us who were trained before in Bangladesh, they have got
Mhm.
manual logbook. Whether they use e-logbook, which we don't do. So if you
No,
get
yeah,
it signed from one of the UK consulate, which in most of the cases is very difficult to get, so no one will sign
yes, I
for
agree.
Bangladesh cases. And if you get signed, I mean, if they trust you, you can show them the manual logbook you have, then that's fine. Before, I have
Yeah,
heard from some of my seniors before they have submitted to the OVL their manual logbook. And they have accepted that.
right. Okay. And another question, if you are in publication with consultant as second or third author, will there be point? So I think the second author will get marks. So you answer third author, like
So the criteria is whether you are the first author or the second, third, fourth, fifth, doesn't matter. So first author will get more points than rest of the author. So it doesn't matter whether you were second, third, fourth, or fifth, or it just matter whether you are a first author or not. So
so
first author
I'd say
will get
that
more
focus
points
on the first author.
than the
If you don't have anything,
yeah.
then submit whatever I would say submit whatever you have.
Exactly.
Uh, yeah, a few marks is better than no marks. The next question is how to show leadership and management role.
So there's several ways kind of lead to build your leadership in NHS. Um, so teaching is one of the most you can show, I mean, you through teaching you can show your leadership, that you have been taught a lot of students, and you are a role model for the students, and you have organized a course for them, and you get it signed from your supervisor, and you can, you know, join to one of the, in BMA, joining the junior fellow representative, junior doctors representative in doctors. You have been rota coordinator. So there are multiple roles opportunity in NHS. You can just have to kind of open your eyes, and you just have to look for opportunities. For my case, what worked, that I have been a rota coordinator as well when I was a teaching fellow. So I showed them, I told them in my leadership questions in portfolio, and I have been a kind of BMA co-chair for the Northeast region for Forum and Racial and Ethical Equality. And what I have done in my role, basically, that uh, that all matters. Not just you have been a rota coordinator, that will not carry more marks, rather than if you say that how it has impacted to be a good doctor, and what you have learned from the rota coordinator role, or what you have done, what you have learned from the from your BMA co-chair role, and how the people were impacted by your work, and how it has impacted to be you a good doctor. So all these answers kind of just write your portfolio answers well before you kind of before the
Sit for the
interview.
interview,
Yes.
isn't it? So I
Yeah.
would say write the note we've got today,
I
the
literally
advice,
use
the
my most
prepare your
questions.
answers
Yeah,
beforehand.
exactly.
Okay, so yes, and prepare your answers in black and white before sitting for the interview, if you're lucky enough to get the interview. The other thing is, I think any evidence we here maintaining portfolio is you put the evidence as a letter. So if it's back from our country like Bangladesh, so I would say just get a letter under the medical college sign, and I think get it signed by the professor or the consultant or the principal from your medical college. I think that would be counted as
And
the evidence.
yes, and if you get it signed from your Bangladeshi consultant or professor, and get it signed from your educational supervisor from here, and say that my training was kind of, I have done a part of training in Bangladesh, but it was a post foundation, but I haven't done FY2. There was no such thing in FY2 in Bangladesh, and I haven't got much exposure. That's why I'm in UK, and I have done this procedure while I was in F2, and I think if your educational supervisor is happy and they get it signed, I think it will. All that matters is the evidence. If they ask you that it's up to them that they will accept or not, but you can show them this way that
Yes,
your training
I
was like
mean, give
F2.
it a try.
Yeah,
Give
but
it a
not more
try.
than
Just
that. If
depends
you
on
have
it.
like, yeah,
Yeah, someone advised me always give it a try. Ask. The worst thing they will do is say no.
no. But
Nothing else. Yeah.
there's a problem with there might be probity issue that you are lying. You don't want that.
Mm-hmm.
So you have to be honest with them. You have to be
Mm-hmm.
rational to put them in such a way. You cannot show them that you have done 4 years of training in Bangladesh, and that was, you put all the 4 years like an F2. It doesn't make sense, isn't it? So
No,
uh,
no.
yeah.
It
So you
has to
can
be rational. Yeah.
show them kind of FY, you have done F2 in Bangladesh, and it was kind of 1 year maximum.
Right. Okay. So I think we have touched all the answers. The questions has been asked. Yeah. Right. I don't think we have any more questions. Okay. So long story short, long information short, go through, check for the criterias. It changes every few years, but check for the criterias. Prepare your things on the basis in terms of evidence. If it's from this country, you will get it signed by the consultants here. If it's the evidence from back in country, get a letter from the country and get it countersigned by the consultants here. All of you might not have the educational supervisors. It depends on trust. Someone gives you supervisor very quickly the moment you join. Some trust delays, some trust doesn't even bother to give you educational supervisor. You are lucky enough to have a specific educational supervisor.
Have to keep
But if
chasing them.
not, you can ask any consultant with whom you share a good bond, good understanding, or they have seen you do things. Get it signed from them. It has to be the educational supervisor. It can be any consultant in this country you worked with. So these are the, I think, the evidence based wise, and the interview, I think, Dr. Jenny has put some insight in us as best way she could. Yeah, there are some groups, I think, in Facebook, or the trainee portal you have mentioned, some resources. I think when you get the
A lot
interview
of
call,
resources now. You can just avail one and start preparing. And the more
go
you
through
kind
it.
of,
Yeah.
yeah, I will suggest, like, if you want to best in the interview, go through all the resources. Just ask any of the, I mean, who are preparing. Maybe they have bought it. I mean, the other resources you can just uh, share with them, and you can share yours as well. So
Mhm.
that way, kind of, you can have all the resources and practice them, practice all the
Right.
questions basically.
Yeah.
And the questions can be critical, I mean, very kind of tricky. uh,
Mhm.
just keep keep in mind what tricky situation um, arises from a kind of can be asked from the this question in the interview, because we just have the main topics or a bit of questions in the resources, not actual question that will ask. It's just a
Mhm.
hint, or it's just a kind of common question that we'll get in the resources. But if you have worked enough in the NHS, and you know the NHS well, and you have the knowledge, and you studied well of that topic, you will get to the point and get to the diagnosis, and how it has been managed, and all the tail questions from the clinical scenarios.
Right. Before I finish, just one question came up in my mind. So this question is from my side. Regarding the publication, is there a necessary, is it a must thing to have a consultant with you?
No,
No, you can do it by yourself.
you can be
You,
first author in narrative, and I said it's publishable in 4 to 5 months.
right, in 4 to 5 months,
You,
even.
you can you can kind of find 4 or 5 friends and start a
Mhm.
narrative review or literature review even, and
How many authors you need?
five, or
Two
I'd say like 4 or 5.
minimum or maximum?
uh Max, you can 7 or 8 kind of maximum, but at least 4 or 5 it's kind of reasonable.
So because I thought it's difficult to pursue people because they all know that if you are third or fourth author, you don't get much marks. So they're not interested. It's hardly difficult to get more than two or three, because for example, if
Doesn't
you want.
matter, like, if you're first author. So what you can do kind of for the publication section, uh,
Mhm.
so you can gather kind of 5 or 6 people, and each of you kind of select one topic, and for which you will be the first author, and you can act as a co-author for the other topics as well, from I mean, the one which your friends are doing. And you
Mm.
can kind of write one section of that article or research paper and get as a co-author. And one you are writing, your friends will be contributed in your paper as well by writing one section of that paper. That's how
Mm.
they will get the co-authorship. It's not just you are writing the whole paper. So you
Right.
get the authorship, you take the leadership role uh, by managing everything, publish it in Curious. You take the leadership, you become you become responsible for one single publication, and um, get your colleague or peers involved in the publication. So that's how you can do 4 or 5 publication basically in 5 to 6 months.
Good to know. And it's just you have to be lucky enough to get four or five people who are interested in publication. So yeah.
There's few groups like uh, in Facebook, or you can in WhatsApp group who are kind of looking for publication. Actually, you can search for them if you're kind of aspiring surgical training. Just look into the Facebook and look into the other social media WhatsApp group who are, I mean, applying for ST3. Are they happy enough to involve in a publication?
Mm.
They want to kind of, you can start writing a publication, even a review article or kind of literature review, or I think narrative review is the easiest one to write and publish in a short duration of time.
Okay,
Uh,
so
just
take
go
the
for it.
narrative review. And how about if I have only two people as author, will that
I
count?
think it will be difficult for narrative review. I think the more you people, I mean, for peer, it has to be peer reviewed. So the more people you got is better, like 4 to 5 people,
Mm.
and the more people you have got, the main benefit, it takes less time to
Mm.
write a paper. So
Right.
each of
Okay.
the narrative review can divide the topics into multiple sections, like say 10 or 12 or 7 or 8 if it's less. But if
Mm.
you've got 8 people to write a paper and each of you write one section, so it becomes kind of each of the section needs 3 or 4 days to write for each person, like 300 or 400 words thing. Um, you can just then combine, review, grammatical check, and of the whole thing, and then publish. You take the leadership role of that paper and get the first author done, first
Right.
authorship of the publication.
Okay. So it's a good point to take note that even if you do publications, you do it all by yourself. To make it look real and nice, you need 3 or 4 authors with you. So yeah, that also shows how good your quality to make good friends, how quick you
Exactly.
make
Surgery
friends.
is all about, not about doing surgery. It's all about leadership and networking, communication skills.
Mhm.
It's
Okay.
more beyond surgery. The most important thing since I have moved to UK, I'm building my communication, networking skills. I was very poor at that, and
Mhm.
so that's the most important area you need to focus on to be a good surgeon.
Right. Okay. Right. Is there any more questions we can ask? We can help with, or Dr. Jenny can put some insight. I think we have touched all the questions from the chat box. So that's it. Thank you, Dr. Jenny, to be with us, to give us the advices. For the podcast session today, I think it's an end. But before ending or before saying it, the end, I would like to say that this podcast has been live streamed on the DMC Club UK Facebook page and will later on be available to see on DMC Club UK YouTube channel. So feel free to go through it repeatedly if you have any confusions or you need to check again what we have discussed here. And yeah, please let other people know so that they can also get benefited. So that's it. Thank you, Dr. Jenny, again, and Dr. Atik again for arranging this wonderful session. I hope everyone will get benefited, and we will see you at some point at space.
Yeah, if anyone has any question regarding surgical training application, they can email me in my personal email. I don't mind at all. I'll be more than happy to help others as well.
That's very generous, I would say.
I'll
Um,
put my email address in the chat box if anyone is happy.
yeah, yeah.
I think you are mute. I think you are mute.
Yes, what I was saying that I should take the your email address also to get the advice in the
Yeah, I
future.
will more than happy. You can text me personally as well.
Yes, of course. I was being very formal. Sorry about that. I can knock you. I have your number. All right. Thank you so much for so I think that's it. We can say it's we can
That's
finish
nice
the
meet
meeting.
you and everyone. Um, any question, just let me ask. I mean, just ask me anytime. Yeah, that's fine.
Okay.
Thank you so much.
Thank you.